There's no evidence COVID-19 vaccines hurt fertility. Here's what's fueling the myth: COVID-19 vaccines are both safe and effective for pregnant people and those who plan to become pregnant, according to all of the data gathered by researchers so far. But the baseless concern or belief that they could hurt a person's ability to conceive and deliver a healthy child has influenced many in choosing not to get a shot. In August, the Centers for Disease Control and Prevention officially recommended that pregnant people get vaccinated against COVID-19, in part because they are at a higher risk of becoming severely ill from the disease compared to non-pregnant people. Those who are attempting to conceive or are breastfeeding should also get their shots, the CDC has said. In addition, there is some evidence that the virus, not the vaccine, could potentially negatively impact sperm production and testicular function. But these facts haven't been enough to convince everyone. Some holdouts might say they're waiting for more information on the potential long-term side effects of these shots. So far, researchers haven't found any, or for official approval by the Food and Drug Administration, like Pfizer's was given last month.
Others seem opposed to vaccination, period. Whether peddled by anti-vaccination groups online or spread by word of mouth, experts say misinformed skepticism around fertility is nothing new. It's important to remember that lies about vaccines and fertility are a standard anti-vaccine talking point, said Dr. Jen Gunter, an OB/GYN and medical writer. Misinformation and disinformation around COVID-19 vaccines have also drawn attention to legitimate problems, like the way pregnant people, and, sometimes, women in general, have been excluded from some drug research and clinical trials, ostensibly in the name of safety. Those decisions can lead to knowledge gaps, which bad actors can weaponize to further their agendas. Here's a look at the tangled history of fertility fears and vaccine skepticism, and how this moment could be an opportunity to address the consequences of leaving pregnant people, women and their unique health concerns out of medical trials and conversations. Preying on concerns around reproductive health has long been an effective way to turn people against vaccination, experts say. Fertility is a personal, often emotional topic, and having kids is integral to many people's visions of their own futures. False anti-vaccination talking points often take advantage of that emotion, as well as the desire to ensure you're not doing anything that could jeopardize chances of having a family. So if you're trying to scare people, it's a really good one to leverage, said Devon Grayson, an assistant professor at the University of British Columbia School of Population and Public Health. But also, if you're just it's something you might worry about. Reproductive endocrinologist Dr. Albert HSU works with patients who have faced and are seeking to overcome barriers to conception. Around 10 to 15% of the global population, he said, grapples with infertility. HSU, who is based at the University of Missouri, estimates that between 50 to 60% of the patients at his clinic have not yet gotten vaccinated. Among the false claims about COVID-19 vaccines circulating online, many specifically seek to undermine trust in Pfizer and Moderna's mRNA-based shots, despite the decades of research backing them up. Though the claims may be specific to these vaccines, they're part of a much larger, persistent infrastructure of false information. If you look more broadly at vaccine hesitancy and resistance over time, we really see fertility fears recycled from vaccine to vaccine, even among vaccines that use completely different underlying science, Grayson said. In the first decade after they were rolled out in North America in the mid-2000s, HPV vaccines were subject to fertility-based fear-mongering with no scientific credibility, Grayson said. Research has never found a link between these shots and negative impacts on reproductive health. In fact, they protect recipients against certain cancers that can cause fertility issues. This was another phenomenon largely due to the fact the shots were initially marketed specifically to teenage girls, they added, and that HPV itself is generally associated with reproductive organs. On a global scale, particularly in formerly colonized nations, vaccines may be associated with fertility concerns due in part to the historical reality that those in power would forcibly sterilize people without consent, often under the auspices of medical care, Grey Sun said. The lingering distrust within communities can exacerbate vaccine hesitancy when reignited by misleading information spread online or by word of mouth. In the United States, hesitancy may be informed by a comparable history of medical abuse, which also included forced sterilization, in some communities of color, said Alexandra Ministern, the Carol Smith Rosenberg Collegiate Professor of History, American Culture and Women's and Gender Studies at the University of Michigan. Fertility and reproduction is symbolically and physically connected to the future of certain communities and whether or not they're being supported and can thrive, or whether or not they're being curtailed and controlled, Stern said. When HSU asks his vaccine-hesitant patients more about their concerns, many tell him that they want to wait for more data, he said. Rather than try to change their minds, he often encourages patients who don't want to get the vaccine before or during pregnancy to at least consider getting it once they've given birth. It's one of those things that takes time. It's one of those things where telling people doesn't work, he said. It really requires asking them, getting their opinions and trying to figure out where you can go together. Back in January, the CDC's guidance for pregnant people asserted that mRNA vaccines were unlikely to pose a specific risk for that population while acknowledging that actual risks to pregnant individuals and their fetuses were unknown because the vaccines had not been studied in that population, according to an analysis in JAMA. At that time, the agency said that pregnant people should discuss it with their doctors. Pregnant people are generally excluded from vaccine trials, including the ones for COVID-19 shots. Grey Sun said that some drugs on the market for decades were never even tested in women prior to their approval, which in some cases can have implications for their performance.
Thank you for watching. Please subscribe,